My name is Bernice McMillan. I am 57 years old. I live in Cornwall. I am no longer working because of my medical issues. I have vascular disease that's been 25 years. My lung disease started when I was 2 years old. I had asthma like my father and hospitalized all my life. And then I started smoking because I thought that was just wonderful, and for about 30 years. And I did more damage to my lungs, and so it developed into COPD. I was getting some services from the hospital, and when I really got sick I went to emergency. Last summer I was having these spells where I couldn't breathe. It would just be getting into the car, it would be going into my house. It might have been 30 seconds, 45 seconds, but it was the longest 45 seconds of my life. I couldn't do anything when I was really sick with these episodes, so I never went anywhere. It got to the point where I didn't want to go out. I couldn't physically do anything, like bringing the garbage in, bringing the garbage out, houseworks. I'm still struggling, but I can go outside and get those garbage cans and bring them to the side of the house, whereas before I couldn't do that. I've got my walker, so I'm going to be able to try and go out for a walk, because I never walked before. I stopped walking, I stopped everything. I quit smoking. I'm in my 7th month. Some of the aids were covered through Seaway Valley for quitting smoking, and I felt like I didn't have that burden of having to scramble around to try and quit. The Seaway Valley is very close to my home, and when I come here there's a spot for people that can't walk very far. And for those who can't drive, the bus comes right here, I'm sure, and drops them off. So I have specialists that have dealt with me for the last 25 years. I've got 3 different sets of specialists, and they're in Ottawa. I hate driving to Ottawa. I hate driving in the wintertime. I know I have to go because those are my specialists and they're there to help me. So I just cringe and I say a lot of prayers to get through my ride. I'm absolutely happy with the staff here. I deal with Joanne Belmore and I deal with Carol Quinlan, and they both have been very, very supportive. Every time I come here I always feel like I'm number one. They may be very busy people with a lot of clients, but I never feel like I'm the 15th client she's seen today. Both of them are like, here's Bernice, let's see how we can help her today. So.
The lung health program is a huge need in our community. We have a high number of smokers, and as a result, a high number of people suffering with cancer and COPD and other lung health issues. Collectively, I think working as a lung health network, we recognize that there's great need, that this is one of the reasons that people use the hospital, our local hospital, due to lung health issues. And so we decided to put together an outreach program where we could work together on a protocol to keep people out of hospital and to improve their well-being and give them the tools they need to have better health living at home.
This program started full-time a year ago of March 2016. The LHIN, the local hospital, and ourselves came up with a proposal to be able to support not just the hospital there, but also look at an expansion of what we were delivering here at the Community Health Centre.
So the Champlain LHIN did a series of analysis looking at people living with COPD. We looked at their hospitalizations, their visits to the emergency department, and their readmission. So we knew there was a real need for more care in this area. Previously, we had a nurse practitioner at the hospital running a clinic with long wait lists. In this new model, we have a nurse practitioner who's housed at Seaway Valley at the Community Health Centre, who works in partnership with the nurse practitioner at the hospital, and we also have a respiratory therapist. So this whole team cares for clients, and they go into the hospital and carry them back out into the community.
We receive referrals from the hospital, from patients, physicians in the community, and we also get self-referrals. And we treat anyone with lung disease, so that could include asthma, COPD, interstitial lung disease, pulmonary fibrosis.
The COPD program, because it's a chronic illness, people have to learn how to live with it, and they have to learn how they can control it, and it doesn't control them. So I think the big thing is education, because then they always feel that they're in control.
I was very, very scared. I didn't know if I was going to live to see next year or the year after. Nobody was hearing me when I was having those episodes. So when I came here, they may not have known what the causes were, but they certainly respected my fear of those episodes. Not feeling alone helps so much when you're chronically ill. Seaway Valley has been a godsend to me as a person, as a mom, as a wife. It's not me coming to an agency. I feel like I'm part of this agency, and I really am happy that it's here.